to the listeners, there are a few other questions as well. However, we have been engaging the panelists for the past 40 plus minutes on these answers. The the next few questions are a little bit generic, so my preference would be that we can answer them offline for you and put them in our website. And I will read out these questions aloud, but just also try to highlight some of the challenges in answering. One of the questions is that what is the success rate of BMT? Now, Dr. Faisal, this question is for you, but I might just editorialize and mention that the success rate of BMT cannot be one single percentage to be set to each patient. The success rate for bone marrow transplant as an indication is indicated for a whole host of diseases, malignant and non-malignant. And within malignant diseases, there's at least 25 different indications. So to whoever who asked the question, being very respectful, I think if we have a little bit more of an idea as to where the question stemmed from, we can be a little bit more specific to the answer. But in general, as was mentioned in most as was mentioned in most talks, bone marrow transplant is, right now a cornerstone in our treatment because it has been shown to stand the test of time, really be tolerable to patients, especially younger patients, and really does have survival benefit in terms of at least event-free or progression-free survival in a lot of diseases, and the gold standard overall survival in some diseases. And therefore, that is why bone marrow transplant is still being favored by us again. So it depends on the disease, it depends on the patient and the treatment used, as Dr. Faisal has just typed into the chat. The other question is that, is there any advantage to allogeneic versus autologous stem cell transplant in terms of disease progression? Again, to the person who asked the question, I think if the disease is mentioned, we can give a little bit more of a particular answer, because again, the answer would vary depending on whether it's myeloma, lymphoma, or leukemia.